Hey everybody, it's Leon with Body Mind 360 Health and Fitness News. And in today's episode, I'm going to discuss with you the COVID-19 pandemic in layman terms, and I'm going to bring up why the real truth about the COVID-19 pandemic is likely to really be an uncomfortable truth. Let's get into the details right after the break. So to begin with, I want to credit a channel called Motivation Madness that put together a really good informational video by Dr. Stephen Gundry about the COVID-19 pandemic and some of the kind of factual information that I found very useful. Do check out the link to their video in the description below. As I found it very, very informative. Now let's go ahead and get into kind of the details that I want to bring up in this video today. So the first thing I wanted to really point out are the two kind of extreme views that you see a lot in the media. And I'm not going to be taking any sides here necessarily, but what you have seen, especially now with a lot of pressure to open up the country, there is one view that's kind of a safe view of the COVID-19 pandemic. And whenever you hear people talking about this perspective, it's generally in line of those that really want the country opened up as soon as possible. The things I hear a lot are, COVID-19 is just kind of a bad flu, and they like to emphasize the thousands of people that die every single year from the flu, and yet we don't close down the country for it. And that seems to be the main talking point there. So the second perspective I kind of call the extreme danger perspective, and it tends to really emphasize just how deadly the virus can be, namely emphasizing its danger to the elderly and those that are kind of high risk and susceptible to the virus. And so the emphasis here is going to be on the high mortality rate, and especially the emphasis on the cases where you have the most severe kind of pneumonia-like symptoms and the system shock symptoms that tend to relate to the death, and we'll talk about that as well. And this perspective really emphasizes maximizing the isolation, minimizing the chance of the pandemic spreading. Now, I want to emphasize that I am not going to get into the conspiracy theories about why we as a country are or aren't doing certain things to deal with this pandemic the way we have, and kind of our strategy how to deal with it not only now but in the future. What I do want to talk about are some of the realities of this virus and why, as I kind of said at the beginning of the video, the reality of everything is that the truth isn't really an extreme in one direction or another. It's really kind of a melting pot, but it really leads to an uncomfortable truth. And let's see what I mean about that. So let's begin with the fact that the majority of people, and some people estimate as much as 80%, even though that's kind of hard to really quantify since we don't have full data on exactly how many people have been infected. We have more data obviously on people that get more severely sick and or die. But the statistics say that it could be up to as many as 80% of the individuals that get the Corona-19 virus have very minor side effects. They may get a cough, maybe kind of like a mild flu-like symptoms. In fact, they may just think they have the flu. Before this became a pandemic, there's a lot of individuals saying that the COVID-19 virus was out there, and people had it and they just didn't realize it. They just thought they had a mild to bad flu. So that is true, that a lot of people will not have really bad symptoms. But that leaves upwards of 20 individuals to have mild severe to extreme side effects. So it could be starting with as bad as a bad flu. It can then also escalate to kind of pneumonia-like symptoms that can also kind of occur with the flu in extreme cases, especially the elderly. But then there's a whole nother level that the flu is not associated with. And staying with layman terms, think of it as a system shock. Your body reacts to the virus by kind of bombarding its own system and causing a ton of collateral damage. That collateral damage, especially in the lungs, can overwhelm the body and cause individuals to, without being put on respirators, basically causing them to die. And even if they are on respirators, because there is no cure for the COVID-19 virus, you're kind of waiting for the body to fight it out and finding out whether it's going to fight off the virus, and even if it does, whether it builds up enough toxicity in the system or not to kill you. This is why, again, sometimes with seemingly really healthy individuals, things get bad and then they die. Less surprising, obviously, with those that are more susceptible to the virus, but it can happen with seemingly healthy individuals as well. So those are kind of the facts that you've probably heard about, and they are true. And as you can kind of see, depending on which side of the aisle you stand on, you could really emphasize or overemphasize either the lighter side effects or the more advanced side effects. The reality is all of it is possible. That's not where the true danger lies, though. The true danger lies in the incubation period of this virus, and this is where it varies dramatically from the flu. So the flu has a pretty fast incubation period. You get infected within a day or two, you know you're sick, you feel really bad. This is important because you can then isolate yourself quickly. You can go home, isolate yourself and get better. And again, the severity may vary. Somebody could potentially, again, die. Thousands of people do die a year from the flu, but you're much less likely to expose others. Now, with the COVID-19 virus, it's quite a bit different. It's not uncommon for individuals to show little or no symptoms for as much as 7 to 12 days. This is why they have that whole 14-day self-isolation protocol, where you kind of want to make sure you're past that contagion period. So why is this important? Well, this is important because you could have the COVID-19 virus, not know it, but be extremely contagious. So you get it, maybe you feel fine, or you have a little bit of a cough, and you say, you may think it's allergies, and all of a sudden you're connecting and interacting with family members, friends, coworkers, you name it, and it starts spreading. Somebody, without even realizing it, could spread the COVID-19 virus to dozens, if not more people, hundreds of people, if we again have mass interactions like we did in the past. And that is one of the huge differences between the flu and the COVID-19 virus. In addition to the incubation period, it's been seen that the COVID-19 virus is much, much more contagious than the flu. You're much more likely to get it through the air and through closer interaction with people. While with the flu, it's a little less likely, comparatively speaking, if you're in closer proximity. Of course, if somebody sneezes on you directly, coughs you indirectly, high contagion rate anyway, but again, we need larger social distancing, it appears like, from the data that's been collected when it comes to the COVID-19 virus than the flu virus, and that's again a big, big difference there. And then there is the final major factor, and this is where it can get a bit scary for the future and where that uncomfortable element really comes in. So we've already discussed what can happen how it differs from the flu in a couple ways. But now comes the unknown factor of its mutation capacity. Now, to explain this more easily, I want to compare the mutations of two other viruses that are very common, the flu and a common cold. So there is a vaccine for the flu. The flu, up until now, has for the most part mutated about once a year, and we kind of fight this battle to try and stay ahead of it. Sometimes there may be two strains active, but this is why, because it's relatively predictable, and there's a decent amount of time between the mutations, that we're able to get these vaccines out and spread them out effectively and efficiently, which again minimizes the mortality rate and the spread rate of the flu. Now you may notice, or you may not know this, but there is no vaccine or cure for the common cold. Now, could there theoretically be one? Yes, but two things go against it. One, there's not as much incentive to really push for it because it's not as deadly or not deadly. But number two has a very rapid mutation rate. So even if you were to get a vaccine, a couple months later, we could have a new strain of the common cold, and we'd be playing kind of infinite catch-up. And at that point, are we just over-vaccinating? Is it even beneficial at all? So again, it gets much, much more complicated with the common cold. So those are your two kind of extreme examples of very common viruses. Now the COVID-19 virus is still relatively new as far as research, and from everything I've been able to gather, there is not a consensus on whether this virus is going to be mutating at a rate similar to the flu, where it's yearly, where it's manageable. Maybe if we're lucky, it could be slower, but there's also the very real possibility that it could aggressively mutate similar to the common cold. If that were to happen, the likeliness of us having a real vaccine for this that we can reasonably mass produce and spread out throughout the country and throughout the world to minimize the impact of the coronavirus, now all of a sudden plummets. If that occurs, that means we are at the mercy of this virus. Is it going to flare up once a year? Is it going to flare up twice a year? Is this going to be a continual concern? And that's where we should all really be focusing on. What are the real long-term repercussions of this virus? Are we going to have to balance out this social isolation versus the economic troubles it has on us? Because the reality is we do need to open up our country for economic reasons. We can't sustain this full-on isolation. But how do you deal with a virus that potentially mutates? It's very contagious. It's hard to detect without testing, and you could even go days, if not a week or more, without realizing you have it, and then having the chance of it spreading like a pandemic. Things have calmed down, but they could very easily go back to how they were before or much, much worse. And this is why I say the reality of the COVID-19 virus, the reality of the truth, is an uncomfortable truth. So I hope that this video has kind of gotten you a little bit more informed, got you to think outside of the box of just one extreme perspective or the other. I don't have the answers. Unfortunately, nobody right now has all the answers. So my personal advice to you is be safe out there. If you can, isolate. If you have to work, but be safe. Don't put yourself in situations where you are interacting with too many people unnecessarily. If you can avoid it, and let's follow the news, follow the scientists. Try not to get caught up in the political game that's going to always have, depending on which side of the political spectrum you're on, they're likely to spin things in one direction or another. But if you can look at the scientific information, the scientific data, we can make better decisions for our future. So stay safe out there. And again, guys, this is Leon, Body Mind 360, here with you on your journey to a healthier body and mind.